Hello and welcome to NAFDAC and Your Health. Every week on this program, we take you through different areas of NAFDAC's activities geared towards ensuring that our health is protected. My name is Tosin Omolaja. Although the spread of coronavirus to many parts of the country has necessitated winding down of regular day-to-day activities across Nigeria, in spite of these, NAFDAC has continued to provide the much-needed service of safeguarding the health of the nation to the people. In this edition of NAFDAC and Your Health, we'll explore the agency's relentless activities to support the containment of COVID-19 in Nigeria.
NAFDAC had already put in place measures to ensure that we have digital online platforms which support our regulatory processes. Those platforms have remained open and they are functional, where we are able to get electronic applications, online applications using the NAPAMS version 2 online platform, as well as emails from applicants who have requests for expedited approvals to address the needs of the COVID-19 pandemic. The digital platforms have enabled us to be able to be responsive to the needs of our applicants as we work to ensure that we have quality products that meet those needs. I mean, whether you're talking about alcohol-based hand sanitizers, you're talking about test kits, or you're talking about personal protective equipment, and also other regulated products that we do have responsibility to ensure access to, we are ready, able, and actually functional to ensure that such applications are processed, promptly received. We engage with clients electronically. The DG had, at the beginning of the pandemic, approved an expedited pathway for the processing of products deemed to be necessary to address the pandemic, where we have a reduction from 120 days to 10 working days. Even with that in place, as we are currently functioning electronically, we have been able to convey approvals within 24 to 48 hours of receipt. Once there are no compliances, we do our reviews and make sure everything is online and all the regulatory requirements that we deem necessary have been met. We have been able to convey some approvals within 24 hours of receipt to applicants to make sure that the products are actually available for the needs during the COVID-19 pandemic. Also, in addition to that, we have been able to work on administrative requests, some compassionate use, for example, also existing registrations where we need to ensure approvals continue to be given, as well as ensuring that we enable the trade platforms, the single window trade platforms, which allow us to process approvals, to allow importation for some of those regulated products. Those platforms are up, running, and have been functional.
We're still granting permits, reviewing a lot of applications for API approvals online. We've been granting quite a lot of approvals for those. We have also carried out a few inspections and formulated a lot of guidance documents that will help stakeholders or researchers that were already conducting clinical trials before the pandemic started on steps they should take in continuing their trials to ensure that there are no compromises, in the integrity of data they will generate.
NAFDAC has been working to ensure essential products required for the efforts at stopping the spread of COVID-19, such as alcohol-based hand sanitizers, are not only in adequate supply, but meets the threshold of safety, quality, and efficacy.
We have the registration at nafdac.gov email, which is open. Applicants can send in their requests through those platforms electronically, and we're working with those electronic requests to process. One thing we do request is that as those emails come in, we expect that we'll be able to communicate, and we have been responding to those emails when we need further information from the applicants to make sure that they meet our requirements. So that has been working. We have had several applications that have been processed and conveyed using this electronic platform for alcohol-based hand sanitizers. That's very specific.
The aim of the agency, in line with the Director General's vision of reducing the country's dependence on imported drugs and other pharmaceutical products like sanitizers, the agency has continued to register more companies to produce quality alcohol-based hand sanitizers in the country.
We had approximately 20 alcohol-based hand sanitizers that had active registration. You know, there's some people that will start a product when there is no commercial need, they drop off the product. So when we looked through the database, we had about 20 products that have active registration. So we have been able to add an additional 55, and it's ongoing. As I speak to you, the reviews are ongoing. We have applications that we're processing. We even had some that just came in today, so we're continuing to process. And as they demonstrate that they're able to meet those requirements, those approvals will be granted and conveyed.
The agency's laboratories across the country have been on the forefront of making sure that the claims made by manufacturers of these hand sanitizers are correct and efficacious in order to stem the spread of coronavirus in the country. The scientists at NAFDAC laboratories have continued to work round the clock to guarantee this very critical item and ensure that the agency meets the demands for approval for registration within the agency's expedited window.
What we are doing presently during this COVID-19 pandemic is that we want to be sure that only safe and quality products are available for Nigerians for use, especially the hand sanitizers. This advent of COVID-19 has initiated a lot of people trying to produce sanitizers suddenly. And we have to be sure that these sanitizers are of good quality and are safe to use. And they can actually do what they are expected to do. So the lab has been receiving a lot of sanitizers recently, and we have been testing them to ascertain their quality. And our sister directorate has been giving them administrative approval so that they can be readily available to the general population for use. But here in the lab, we make sure that whatever we approve is of good quality and they can actually perform the functions it's supposed to do.
The analysis of these alcohol-based sanitizers are also conducted at the Central Lab, Oshodi.
Here in Central Laboratory Oshodi, we're concerned with the analysis of the ethanol content, the alcohol content. Ethanol and isopropyl alcohol are used for the production of the hand sanitizer. And there are specifications and quantity that is supposed to be present in the hand sanitizer. So we do the analysis using our GCFID to detect the quantity of these active pharmaceutical ingredients present in the hand sanitizers.
The Oshodi lab, which is primarily a food lab, has also been working on the analysis of several food items meant for distribution as palliatives across the country, testing for their suitability for consumption.
The lab has been open since the lockdown due to the pandemic COVID-19. We have been engaged in the analysis of palliative food items such as rice, beans, vegetable oil, as well as tomato puree that has been used for the palliative measures to the masses. We ensure that these products are wholesome and can therefore be served the purpose it was meant for. This we have been doing, and we spend day in, day out here, including weekends, because these things are coming continuously.
Beyond all this, the agency also is working assiduously to ensure that the right quality test kits are available for use in the country.
The COVID-19 test kits have been one of those products that we've looked at very, very closely. If you listen and you watch what's going on globally, there's a lot of attention being paid because they offer some measure of a level that we need to get to be able to address the COVID-19 pandemic. They have a place within the process, and we have been able to review quite a few. We have several applications for COVID-19 test kits, but we are exercising a lot of regulatory control and regulatory reliance. We're looking to see that they meet certain basic minimum requirements before we process them, which include the current registrations that the products do have, the jurisdictions where the products are also registered and available, as well as if they have conformity markings, if the facility can show that it has ISO designations which show that they have a quality management system in place, as well as some products that are listed for emergency use by the WHO. So we use these different criteria to look through what is coming in. Again, we've been very, very mindful of the fact that we need to ensure that there is an in-country validation of test kits. Because if you follow the science, you know, there is need for these kits to be validated. And so we have put that as a requirement. That's why it's conditional, and no test kit has been given full registration. There's a conditional approval given so that we have access, and there is a requirement for in-country validation for those test kits that have been so approved. So in order to move to full registration, it would be dependent on the in-country validation, which will demonstrate whether the kits are actually specific and sensitive in our environment.
We'll take a short break now. Stay with us. Welcome back. NAFDAC has put in place an expedited registration pathway to allow the granting of emergency use authorization for masks and personal protection equipment.
If you're watching the news and the media, you see that there are global shortages. Because of that shortage, you know, the regulatory guidance is that those should be reserved for the healthcare professionals who are actually handling patients or working within the medical environment. We do not have manufacture of medical masks in Nigeria as we speak today. I know there's a lot of interest, and a lot of business entrepreneurs are looking into that area. But the production of personal protective equipment has specific requirements that those materials must meet in order to convey the protection to the healthcare professionals. You know, the material of construction has to meet certain requirements in order to protect the healthcare professional. Those are very technical and specific requirements which are global standards. So irrespective of where you make the masks, for example, if you are going to designate them as medical masks, they must meet those criteria. I'm not saying we can't make them here, but we have people who are looking into those requirements and looking to see what they can put in place to meet those requirements. And I would not be surprised if very shortly we will have indigenous manufacturers of face masks, for example, you know.
The race to find a vaccine or medicine for the treatment of coronavirus is a global one, and NAFDAC has stayed active in this regard within the sphere of its regulatory responsibilities.
At times like this, when you have pandemics, there's always this scramble for research into drugs, you know, that will treat disease of interest. And presently, there are lots of researches, you know, going on for treatment of the COVID disease. And in Nigeria, as the responsible organ of government for regulation of clinical trials, we have been doing quite a lot in the division to formulate a lot of guidance documents that will help researchers that already carrying studies, you know, on how to continue with the studies without disruption. And then also for those who are interested in starting new studies that will treat the COVID disease, you know, people have, one or two groups of individuals have indicated interest.
There has been a lot of talk about clinical trials. For a vast majority, The concept of clinical trial can be alarmingly misconstrued. So, what is a clinical trial?
Clinical trials are studies conducted in humans, to look at new ways to treat diseases. It could be for new drugs, it could be for new medicines, or for new combinations of medicines. It could be for even new surgical procedures. And it could also be to look at the use of old drugs, existing drugs, in treating new diseases like in COVID. Of course, you know that presently there's a lot of interest. People are showing a lot of interest in establishing whether chloroquine and hydroxychloroquine are efficacious in the treatment of COVID. So far, no drug or vaccine has been invented for this treatment. And so the scramble is for how we can use existing drugs to find treatment.
NAFDAC plays a significant role in the overall process of clinical trials in Nigeria.
NAFDAC is a regulatory body that oversees to the conduct of a clinical trial. And so when a party, a company, an institution, an individual is interested in carrying out a clinical trial, they make an application to NAFDAC that they want to carry out a clinical trial. These people or group of persons that want to initiate this trial are known as the sponsors. Now, the sponsor produces a protocol, all right, and picks a principal investigator who is going to oversee or conduct the trial, the study for him, okay? Now he submits his protocol to NAFDAC. NAFDAC reviews that protocol. We review it for the scientific rationale for the study and the product. Mind you, we are not the only group that reviews the protocol. The ethics committee, the research ethics committee of the hospital where they want to conduct the study must also approve this protocol, because the responsibility of the ethics committee is to protect the safety and well-being of these trial participants. Now, this trial is supposed to be conducted at a site, the trial site. We are also responsible for the inspection of that site to make sure that the site complies with everything required for good clinical practice, as well as ensuring that, yes, there is adequate protection for the participants. The study must comply with the requirements of good clinical practice because it's an international document, it's a scientific process. You know, there are no ambiguities about the process of, clinical trials. It's either you do it well or you don't do it at all. And so, like I said, our role is to make sure that the conduct of the trial follows scientific principles. And while this process is ongoing, we expect and demand that the sponsors must, on a quarterly basis, give us the progress and safety reports, from the trial. And then at the end of the trial, when the trial closes, they are supposed to notify NAFDAC that they have finished with the trial. They're also supposed to submit to us what we call a preliminary report, of that trial. And then at a later stage, they're supposed to give us a final report. That takes a bit of time because, the people who have carried out this process, we have to lock their data. They have to clean it out. They have to analyze the data. validate their processes, and then make a final submission on the outcome of the report to NAFDAC. Now, they submit it to Clinical Trials Division. We look at the report, study it. We bring in also a lot of experts to give their opinion on the outcome of the conduct. If it is satisfactory and there is enough evidence to establish that, yes, this drug or product can treat the disease, the company can now make a formal application to register the product.
A number of people have made claims about traditional cures for the disease. NAFDAC, however, must be able to scientifically prove the efficacy of these medicines before it can be approved for use, and the public are expected to be cautious of such claims.
What is interesting about science is that there are no ambiguities about science. 1 + 1 is 2. It will excite us really to find out that one of our traditional, herbs or products can treat COVID. But NAFDAC is a scientific organization. We don't base efficacy based on testimonials.
What we are doing now in NAFDAC is to ensure that our herbalists and our researchers come together. First of all, signing confidentiality agreements so that our own herbal medicines can be translated into products. And that is where NAFDAC comes in. When you are able to translate it into product, then we have to test whether it has a lot of microbes or germs and whether it is toxic. We have animals that we use, mice, rats in the lab, to know whether the herbal product will kill them or how quickly they will be affected. If those two are satisfied, we approve, but restricted approval. And we put them in the category of listed products. And we put L after the NAFDAC number. And the advice that we give to such an applicant is, we're encouraging you to do clinical studies. Because it is when you do clinical studies and you have parameters and variables that you can say, okay, I increase the dose by this level and I'm getting the effect. By this level, I'm not getting effect at all.
And so we will encourage these people to go to our website, look at all the requirements for conduct of clinical trials, and then make the appropriate applications. We're there to help expedite their process, help guide, but we cannot partake, in the trials, but we can guide them, I mean, we've heard all sorts of things, when there was Ebola, people will come, make all these claims. But when you encourage them to put those products through trials, they don't ever come true. And so far, nobody has come. We only read these things on the pages of newspapers. 1 or 2 people have written, and we have advised them, to put it through trials, but they don't want to do that.
We have to go now, but we'll be back next week. In the meantime, we believe you may have questions, comments, or inquiries. We would love to hear from you. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700-162-3322. For complaints, please call 0800-162-3322 or email nafdac@nafdac.gov.ng. Always remember that safeguarding the health of the nation is our collective responsibility. So if you have information about fake and unwholesome food and drugs or activities that create them in your area, kindly let us know. Till next week, stay safe.